In this video, we are going to discuss the psychotherapeutic intervention that target interpersonal difficulties in the context of ADHD. But before digging into specific intervention, let's consider why this is so important to focus on this domain in ADHD, even though interpersonal difficulties are not part of the diagnostic criteria of ADHD. Existing studies show that youth with ADHD tend to have less friends and to have a lower quality of friendship compared to the general population. The thematic of bullying, either if the child is a victim of bullying or a perpetrator of bullying, is also increased in the context of ADHD. So as I just mentioned, social difficulties are not part of the diagnostic criteria of ADHD, but they can really be seen as the negative consequences of the core ADHD symptoms. For example, attentional difficulties can really create a challenge to really perceive and respond to social cues and also to solve interpersonal difficulties and problems. Hyperactivity and impulsivity can also create difficulties in the social context. For example, youth with ADHD tend to have difficulties to wait their turn, or they can interrupt in the conversation. They can also play in a relatively abrupt way, or impulsive behavior can also lead to aggressivity towards others in the most severe cases. So all of that suggests that it's really important to intervene on social difficulties, but the specific mechanism contributing to social impairments can really vary from one child to the other. So a specific assessment is really required to determine what are the factors contributing to social difficulties in a specific child. So as we just discussed, some level of social difficulties is expected in the context of ADHD. However, if social impairments are really at the forefront of the clinical picture, it's important to consider that there could be a comorbidity with other diagnoses, and especially with autism spectrum disorders that are characterized by marked difficulties in the domain of social interaction and communication. As you remember, in a previous video, we have discussed this issue of comorbidities and the fact that ADHD is often comorbid with autism spectrum disorders. So in terms of intervention, there are relatively few studies that really inform us on how to intervene on those social difficulties. As I just mentioned, social difficulties can really be seen as the negative consequences of core ADHD symptoms. So, of course, an adequate treatment of impulsivity, of attentional difficulties can also have, as a byproduct, an effect on social difficulties. But if we look at intervention that specifically focus on the social domain, basically there are two main approaches. So either it's possible to acquire new social skills, for example, through the development of a social skills training, and the other approach is really to develop a psychotherapeutic intervention if we consider that actually those basic social skills are there, but the children tend to have difficulty to use them in the real life situations. There is, as I just said, not much literature in this domain, but there are some studies conducted in children who are describing play-based intervention, because play situations are really some naturalistic interaction where the social difficulties can emerge. And this intervention has been based on the observation of typical play situations between a child with ADHD and a typically developing child. And those observations has shown several interesting information. The first information is that children with ADHD do not spend less time interacting with other children, but the quality of this interaction tends to be lower, and this for several reasons. The first reason is that the child with ADHD tends to be a little bit more self-centered, in the sense that he tends to have more difficulty to adjust to the social signals sent by the peer, and also to notify affective changes in the partner, for example. The second set of difficulties is a difficulty to maintain the flow of the play, because the child tends to have more difficulties to maintain his motivation on the same activity for a prolonged period. So based on this observation, this play-based intervention has been developed to work on 4 specific components. The first component is to help the child to maintain a high level of motivation, either to interact with the peer or also to stay on a given activity. If necessary, it's also possible to provide accommodation in the environment to promote the level of motivation of the child. The second element is really to work on this empathetic response and to really develop this idea that the interaction is bidirectional and should not be too much self-centered. The third element is really to involve the parent as well as typically developing children in the intervention so that we can really work on these abilities during a real play situation. And the final component is to use really skills that tend to increase specific behaviors such as modeling techniques or video feedback that we will see in another module. As I already mentioned, there are not so many studies focusing on this type of intervention, but the ones that exist tend to suggest that this play-based intervention are quite effective to reduce the impact of ADHD symptoms on social interactions. In older adolescents or adults, there are no specific recommendation or no specific intervention techniques that have been developed or tested in the literature. However, our clinical experience suggests that it's really useful to accompany these young people throughout their development to really try to decompose the social interaction that were difficult and also to find some new strategies. And it's also important to help them understand that they could have played some role in the difficulties, in the social difficulties that they have described, and to increase their level of awareness about their own behavior. In conclusion, we have seen in this video that social difficulties are really part of the clinical phenotype of ADHD in children, in adolescents, but also in adults. And we have seen that some specific psychotherapeutic interventions that are based on play can be useful to decrease the impact of ADHD symptoms on social interactions.